are praise singers. Since ancient times, the troubadours of the Yoruba people of West Africa. Nigeria has a rich past, inherited from the different cultures that have been here for centuries. And since independence in 1960, Nigeria has been trying to merge traditional and modern in the development of their country. This is Lagos today, the capital of Black Africa's most populous and wealthy nation. Nigeria's booming oil industry has brought with it a new prosperity. But that very prosperity has brought problems. The problems of rejecting everything old in favor of something new. In this film, we focus on how Nigerians are resisting that pressure by trying to gain maximum benefit from their older traditions. We look specifically at how they are adapting their ancient medical practices to fit the 20th century. These are some of the doctors who serve Nigeria. They are members of the Nigerian Association of Medical Herbalists. They call themselves traditional healers because they practice the medicine taught by their forefathers, a medicine based on herbal remedies. They call our system of medicine orthodox medicine. Under British colonialism, the practice of traditional medicine was discouraged, or sometimes forbidden. Traditional healers were called witch doctors by their colonizers, who viewed their medical practices as inferior. Since independence, the Nigerian government has decided to give these healers official recognition. They do not take the place of university-trained physicians. Rather, they offer an alternative source of medicine in which many of their people place great faith. Although discouraged, the practice of traditional medicine never really stopped during the colonial era. The government's current position is really just a recognition of reality, that healers serve a great majority of the Nigerian people. Nigeria's experiment is a chance to see if developing countries can make use of a great resource. Thousands of traditional doctors who have centuries of folkloric knowledge about medicinal drugs. Nigeria is not alone in believing that traditional medicine may be important to its health system. The World Health Organization in Geneva has officially endorsed the use of traditional healers to supplement medical care in the Third World. The inspiration for WHO's present policy came from Dr. Adeoyo T. Lambo, a Nigerian psychiatrist who is now Deputy Director General of WHO.
It is important to know that there is no society that is static. Every society is moving. It's dynamic. It's a dynamic phenomenon, a living reality. And because of that, there's tremendous amount of room for modern technology, for modern medicine in so-called third world. But the idea is not to swallow the ones which may, in fact, have been long tested, stood the test of time. And the idea is to have a syncretism, to match them, to marry them, so that they can really complement, each other. So this is what we are trying to do. Not that one is better than the other. Where one fails, the other succeeds.
In an old section of Lagos, members of the National Herbalist Association meet to pool their knowledge about the medicines they use. Under colonial rule, they practice in great secrecy. Now they are eager to compare the ways in which they make various medicinal preparations and to compare the dosages they prescribe. This is the beginning of an effort to develop a pharmacopoeia of traditional drugs. This healer is describing the Olenlandia root, which is used to accelerate contraction during pregnancy. With it, university-trained scientists are able to produce similar contractions in pregnant rats.
So we refer that be lali.
100 miles from Lagos, a laboratory assistant from the University of Ife's Drug Research Unit walks through the forest with a traditional healer as his guide. They are gathering plants used in traditional medicine. First, the Fagara root, which is used to clean teeth. It's a new phenomenon for a university science department to be working with a traditional healer. They gather leaves from the neem tree. Traditional medicine prescribes these leaves, boiled as a tea, to combat fevers, especially malarial fever. When they get back to the university, the laboratory assistant and the healer first catalog the plants and identify them both by their Latin and Yoruba names. The healer then describes how the Fagara root is used to clean the teeth and keep them free from infection. This new collaboration between herbalist and orthodox doctor has revealed other possible uses for the Fagara root as well. While doctors here were testing the root chemically, they discovered that, simply brewed and drunk like tea, the root appears to combat a genetic blood disease, sickle cell anemia. It may be able to prevent some of the effects of blood sickling. Dr. Isaac Chaudier explains.
Traditional healers had always recommended Fagara chewing sticks for the purposes of cleaning teeth, but they did not necessarily know of its sickling significance. Now, we came across these chewing sticks accidentally. We decided to look at the germ-killing properties of these chewing sticks, and that is how we discovered that they also had anti-sickling properties. The major features are that an individual inherits the abnormal hemoglobin S.
This abnormal blood cell is sickle-shaped. Groups of these cells hook onto each other and clog the bloodstream, which prevents oxygen from traveling through the body. As a result, vital organs may be destroyed.
There are like 3% of all individuals in this part of Nigeria who have sickle cell disease. The carrier rate is about 25%.
If the Fagara root's active ingredient can be extracted in the laboratory, it will then be tested chemically and biologically. It might prove to be a cheap and locally accessible drug to help control the effects of sickle cell anemia. The research unit is investigating traditional medicine's claims for more than 200 plants, for their effectiveness in treating viruses, malaria, and even cancer. Within the next decade, some of these plants may end up becoming the basis for more drugs in the world's pharmacopoeia. The department bought a machine that stamps out pills. Here, they are trying out a powdered extract of Fagara root. Their dream is to produce pills from extracts of the plants they are studying. They could sell them locally, thereby avoiding expensive imports.
This is a sunfupa. Botanical name is red berry. So it's very good. I use it for jaundice in connection with other plants.
Dr. Esho, a traditional healer, is a case in point. He can gather most of his medicine's ingredients in his own garden.
Then we use this, we call this alucarese, this creeping plants. So we call it alucarese. We use it instead of iodine. Instead for us to go to the chemist and buy iodine, we use this. We just squeeze it like this, in hand like this. The water from it, you put it on at any cut place, then the blood will stop automatically, and it will destroy the bacteria. Now, the next thing I will mention now is Oruwo. This is Oruwo. I would like to collect some now. The botanical name of it is Cinchona. You see, it's really for fever, headache, and other things like that, like pains. So when taken like that, then you can turn it to medicine raw like this with water, of which I will go and prepare now and myself. And when taken like that, it's really good for your yellow fever. It's good for yellow fever indeed, when taken like that. So I will go and prepare this now, straightforward.
Dr. Escher was translating from Yoruba, in which the fever which accompanies jaundice is called the yellow fever of jaundice. Many of the drugs we use today used to come from the gardens and from the trees and plants of the forest. Valerian tea is a sleep inducer from the valerian root. Digitalis, which is used in cases of congestive heart failure, comes from the foxglove. The contraceptive pill from the black yam. Most of these drugs are now manufactured in chemical laboratories, but they had their beginnings in nature. The extract from this leaf contains an active ingredient which traditional healers use to lower fevers. We take a chemically related medicine called chloroquine in capsule form when we travel in areas where there is malaria.
Let me test it a bit. This is a cinchona. It's a medicine from cinchona. It's good for yellow fever, headache, cold, and other inflammatory diseases. Yes, it tastes like quinine. It's very nice for the body. So this is ready for my patients.
These traditionally used medicines, bottled in an up-to-date style, almost certainly contain some active ingredients, and university research centers want to find out what they are. Perhaps in the future, Nigeria will be able to manufacture traditional medicines commercially. These might take the place of more expensive imported drugs. Nigeria would like to be able to manufacture more at home and buy less from abroad.
I think it's obvious that they have to find alternative approaches simply because the present Western-oriented approach to health care system is extremely expensive. It is almost culture-bound from the point of view of institutionalization. It requires such a diversity of specialized people, nurses, and a long sort of what I will call a sort of spectrum of health workers and so on. All these things they cannot afford. It will take almost a century for many of these very poor countries to be able to afford gigantic institutions, such a sort of organization that you have in developed countries, the apparatus and equipment for them to be able to, do anything effective.
Nevertheless, unlike many other developing countries, Nigeria can afford to build at least some hospitals. But even so, the effort will take a long time. This is a prominent university teaching hospital located in the city of Ibadan. It can handle most of the same cases as hospitals in the West, and the doctors here are well trained. But there are not enough of them, nor enough support staff, nor enough beds, nor enough medical equipment, which has to be purchased overseas. Professor Olatawura is concerned about the ability of these hospitals to handle the needs of patients today.
This crowd you see here is just a small fraction of the population of patients we see in this hospital every day. We have very few doctors to attend to sick in this community, and many of them may have to wait several hours.
Malaria is endemic in Nigeria. More than 1 million people suffer from attacks every year. Hundreds of thousands suffer from measles, polio, and serious parasitic diseases. Nigerians want to believe that this new kind of medicine will solve these health problems. But for now, the system cannot cope with the numbers who come. The orthodox hospitals simply don't have the resources to treat everyone.
And I think would underscore the most important thing about the traditional healers. Namely, if they were to withdraw their services, we will be in trouble.
Some people even prefer to see traditional healers. The hospital wants to find out why. So they interview families around the city. In this interview, the family is middle class, but comes from a background rooted in Yoruba traditions.
You use both traditional medicine and modern medicine. So it will be interesting for us seeing you here, 3 gentlemen who belong to the same family, your brothers, with your 3 wives and your children around. Among your children, can you tell me who was born in the hospital? What of that one?
Not born in the hospital.
Not born in the hospital?
Yes.
What of that one?
The same.
Not born in the hospital? Yes. Why is it you never delivered in the hospital?
I was told that I would deliver premature, and the pregnancy was about 10 and a half months by then. So the doctor was all the time telling me that I miscalculated the month. So, and I was sure of the time that I I missed my period. So when we were both confused,
you and your husband?
I and my husband. So we decided to go home. We went to my father-in-law then. My father-in-law went to a herbalist.
This woman, confused by what may have been a misdiagnosis of the orthodox doctor, turned back to a more familiar source of advice, the traditional healer.
He promised us that before 5 days I will put to bed. And it was after the 4th day I delivered the child at home without any complaint.
Chief Fagbenro is a prominent traditional healer in Lagos. The setting is different from that of the noisy, overcrowded hospital, and although the cost of seeing him may even be higher than a hospital visit, his patients are willing to pay. The chief is an excellent advertisement for his cures. At 70 years of age, he's only been to see an orthodox doctor once, when it was found necessary to amputate one of his legs. He's quite willing to admit the value of orthodox surgery. Otherwise, he prefers to live by his own medical traditions. Chief Fagbenro's diagnosis differs in at least one vital way from orthodox treatment. Traditional Nigerian healers view physical illness as the outward manifestation of metaphysical problems. Chief Fagbenro is a healer and an Ifa priest. It is the latter title of priest which gives him such a high status, since many Nigerians believe that illness is often caused by being at odds with the supernatural. So the spirits must be invoked to advise on cures. The spirits are also asked to prevent harm from befalling. For example, a young man who feels that spiritual protection kept him from being hit by bullets during the Nigerian war.
During the war in Nigeria, I was in the battle, and I have some marks made on me. You can see it on my chest. Now, this is some sort of protect on me. Now, I have a sacrifice I normally make every year, and I have some forbiddings, so that I will not, because we believe in super beings. This sacrifice and the forbidden make me obey.
So in traditional medicine, you have your protective medicine also.
Oh, yeah,
preventive medicine.
Yeah, preventive medicine.
Wow. Even to the extent that if you are given bullet, it will not make any effect on
It
you.
will not make any effect.
Oh
It
my
will not
God.
penetrate.
And that's one of the things you have got in you.
Oh, yes, that is the marks you see on my
It's a kind
chest.
of what you call immunization or vaccination.
Oh, it's a sort of immunization.
So you have immunization of a particular kind. And you are immune. You are proof against bullets.
Bullets, yes.
Oh my God.
In the past, such claims on the part of traditional medicine put off orthodox doctors. But today, there is a recognition of what we might have in common. There may not be agreement about what a spiritual vaccination can accomplish, but there is growing agreement on what an herbal-based remedy can do. After consultation with the Ifa oracle, this patient is being given a medicine that has been used for generations by Chief Fagbenro's family. It contains Morinda lucida, a substance said to reduce fever.
The world is now focusing its attention on, traditional medicine. And then, in places like India, China, and possibly Egypt, traditional medicine and orthodox medicine go side by side. One accepting the efficacy of the other. And where one feels weak, the other comes to help. I should think the same situation will ultimately exist in Nigeria, where we have vast materials for the preparation of medicine. Now, I will tell you, myself, my children, my family, we go by traditional medicine. Anything happening to any of my children, we go traditional medicine. I personally, as I told you, I left the hospital since 1968. I've never been back there for treatment. I go by traditional medicine. So that traditional medicine, I would like to say, has its advantage, and the advantage it has is that we are using nature's own cure.
Here, broken bones are being set by what Chief Fagbenro calls nature's own cure, instead of by orthodox techniques. Many people prefer to come to traditional bone setters, although the treatment is painful. This clinic proved to be a successful alternative for one woman who became dissatisfied with the orthodox hospital treatment she was receiving for her broken arm.
We go to Teaching Hospital University at Lagos. So the treatment, the hand is not very nice. And I was told that a woro know how to fix hand broke. From there, I come from Lagos. So since 2 months now, I'm here.
The method is to set the bone in a loose splint. The emphasis is then on keeping the muscles supple. Daily massages are given, in which the healers seem to know just how far they can move the broken limb without re-breaking it. When patients leave, they usually are able to go right back to their former work with no further therapy. This woman is finding she can now move her arm for the first time since it was broken.
Before, the hand can't go up. Now it's getting better, it's going up. I can't take my hand, eat before. Unless I hold it like this before we eat. Now, I'm using it, bath, do everything. I'm so happy. They are very nice, Eguru.
One part of the treatment is linked to the supernatural. The limb of a cock is broken in approximately the same place as that of the patient. When the cock's limb heals, the patient is supposed to be ready to leave.
First of all, then we put cock down. Then when they look the cock finish, when they broke the cock, like my arms like this, cock arm, then broke it, then broke my own. So if the cock is feeling better, my own is feeling better.
These were the earlier notes.
Traditional bone setting and traditional medicine in general take many years of strict training.
All these things, all these were earlier notes I took from my father when I was undergoing both the theoretical and the practical study of, traditional medicament and Ifa divination. And then he developed into all these, and I still have volumes which I have to refer to for consultation anytime I am in doubt. We don't assume that one is qualified to practice until after at least 10 to 15 years. Yes, because of the life problem involved. A traditional medical practitioner has no room for any misjudgment. Every time you must be accurate. You are not allowed to have made any error by misjudgment. So that's how I learned directly through my father, and at the same time, through we have something in Ifa we call Oluwo, which is your high priest, your own priest. And my own high priest, known as Afolabi Abudu, a combined traditional healing also. So I learned from him also.
This is a group of students being taught by a high priest in the way Chief Fugbenra was taught 50 years ago. The beliefs and knowledge of the Yoruba people have been passed on from generation to generation in this manner because Yoruba was not a written language. Everything had to be recited and remembered. This oral literature, thought to be longer than the Bible, contains the accumulated experience of the Yoruba in all matters of importance to them: religion, agriculture, love, friendship, and good health, without which, they believe, there can be nothing else. So a woman with a difficult pregnancy will be advised to use a plant concoction called agungu. A person with fever will be given a concoction prepared from the morinda leaf. The medicines used by traditional healers are prescribed by the literature of Ifa. Much of the land of Nigeria is forest, filled with the spirits and legends retold by tradition over centuries. Ifa priests are the guardians of these tales for the Yoruba. They bring both practical advice and the wisdom of the gods to bear on the problems encountered in this mysterious world. However, it is not just the Yoruba, but many other cultures of Nigeria who live among these forests and seek help for their ills from their healer priests. Down a long road in the forest, 60 miles from the city of Benin in eastern Nigeria, lives a priest of the Igbo people, Mr. Monye. Mr. A.D. Monye is a well-known traditional specialist in dealing with mental illness. His patients believe he can summon the power of the gods in their behalf. And this is an important incentive in their family's decision to bring them here rather than to an orthodox psychiatric clinic. Mr. Monye sanctifies the arrival of a new patient, calling upon the spirits to address themselves to the boy's troubled condition. In our terminology, the boy is mentally ill. In the Igbo language, he is called Onye Ara, meaning that his head is out of balance with the world around him. He is the victim of an unfortunate encounter with the gods. Mr. Monye inspects his physical condition for signs of enlarged glands or specific pains which might diminish his ability to cope with the more grievous state of mental illness. Many healers are cautious about revealing the ingredients of their medicines. But a popular sedative drug given to patients with mental disorders is rawufia from the snake root plant. When Mr. Monnier feels that a patient is cured, he takes the patient into the forest to a holy tree. Mr. Monnier calls upon the good spirits of this place to return the patient to society with their blessings and protection. Mr. Monnier has an understanding of this patient's world that is rooted in traditions that are quite different from those of an orthodox psychiatrist. But today, the spirits of the bush are not the only influence upon one's life. There is a newer, changing world as well.
You said you are a member of CIA.
Exactly.
For CIA, what is the meaning of CIA?
Central Intelligence Agency.
This patient, believing himself to be a member of the American CIA, is with his mother at a weekly session with orthodox psychiatrists. For Dr. Lambo, this is a special return to the village where he worked 20 years ago. In Nigeria, a mother or other relatives will always want to stay with those who are ill. Illness is considered a family concern. Patients with mental disturbances are especially in need of support from their family and culture. But in Nigeria, the dilemma is that there are two cultures that can influence one's stability. The voices of the gods are muted in this psychiatric session.
Well, if you claim to be a member of CIA, are you paid?
No.
Nobody pays you?
No, nobody pays.
You heard what your mother said about you just some few minutes ago. She claims that she's almost crying now. She claims you shout on everybody, you claim to be head of state, you disturb the lifestyle at home, and you really prove to be above every person in the home.
Dr. Lambo asked the patient how often he has used cannabis or marijuana, a drug which is becoming popular and is considered destructive by many Nigerian doctors.
Here is a young man, 29-year-old, left his college, no job. He fell into the hands of a gang of young people who were smoking cannabis. He joined them. It's not an isolated case in Nigeria or in any developing country. It's a recurrent, a phenomenon which is new because of the recent socio-economic development. And I think it's very important for all of us to appreciate that the patterns of disease, the patterns are changing as the society itself is evolving.
The problem is finding a balanced way of dealing with psychiatric patients who must cope with the pressures of two different societies. 20 years ago, Dr. Lambo became director of this modern neuropsychiatric hospital. He soon discovered that staying here heightened the anxiety of many patients who might never have been separated from their families before, nor seen a hospital ward. So he took a walk to a nearby village, Aro village, where he asked the chief, or Bali, and the village council if he could board the patient to the village itself, where they might feel more at home. The suggestion was accepted. Now, 20 years later, he's come back for a visit to greet the new Bali and to speak with old friends. The program established here has become a model for similar ones throughout Africa.
What I've been discussing with the chiefs in the village to remind them how we started as far back as 1954 with the first ballet, assuring them at that time that we will be billeting into their homes patients suffering from mental disorder of varying degrees, of different kinds, from various parts of Nigeria, And I was asking him, are they satisfied with the debilitating of the patients, with their families? He said no patient has ever committed any crime. No children of the normal families have ever been assaulted. The Bale, the head of the village, has 2 patients, has 3 patients in his own house with their relatives. And you must also understand that no patient comes here or no patient is admitted into this village without being accompanied by 1 or 2 of their relatives. When we came here in 1954, there was no electricity in the village, and now there is electricity here.
The village, in fact, has benefited greatly from his own hospitality. Both individual families and the village council have received payment, rent from the billeted patients, and funds from the government and the international agencies.
Second point, which I think should be pointed out to you in terms of improvement of the village, is the tap water. Is here. I think I should show you here that here we have a water system from the city, from the town. Before that, they used to go to the big river, which is a little bit polluted. Now we've brought water right from the city of Abeokuta straight here, and this has improved the general conditions, health conditions of the villages. I think it is important to see this lady. She was one of the first women in the village to participate in the council of the village. She is the most powerful lady in the village, politically and socially. She said she's very old now and she's not as well as she used to be. I said, well, this is true of me too.
Dr. Lambo initiated in 1954 the concept which the World Health Organization is encouraging today. That is to make health care both acceptable and appropriate to the community that uses it. In cooperation with the village council, Dr. Lambo and his staff did studies comparing the rate of recovery among patients billeted in the village with that of patients staying in the hospital. They found that the patients in the village recuperated more quickly and had fewer recurrent symptoms. Here, patients wander freely and intermingle with the villagers. They're not separated from their families, nor the things that have always been important to them. Churches, shrines, priests, herbalists, and the continuity of community life all contribute to successful therapy.
So there is, in fact, a wealth of psychotherapeutic strategies within the village. Absolutely. Something which, in fact, does not exist within a hospital or any institution.
Back at the neuropsychiatric hospital, Dr. Lambo attends the groundbreaking ceremony for a neuropsychiatric research center. Sponsored by the Nigerian government and the World Health Organization, the center will attempt to close the gaps between institution and community, between orthodox and traditional, by bringing all of these resources to one place. It's the first time that traditional healers are being asked to participate in such a far-reaching program. Dr. Lambo.
For the first time, they feel that the government, the international organizations are recognizing them, that they can make contributions. Actually, the idea of getting in touch with the traditional healers, well, for many reasons. One was the question of trying to establish the norm of the society. What was there before I came on the scene. To have some perspectives, to know what kind of treatment strategies are relevant to the African scene. Secondly, to be able to do some research with them. with the traditional healers to know exactly what kind of things they did. How did they manipulate patients? What kind of patients do they have success with?
The kind of research that Dr. Lambo was talking about has already begun, even before the opening of the research center. In Ibadan, there are 20 traditional psychiatric healers. One of the most respected and experienced of them works in a compound at the center of the city where Dr. Olatuwuda visits him twice a month. Dr. Olatuwuda, at one time a student of Dr. Lambo's, goes to see most of these healers regularly and attempt to create a bridge of trust and understanding. This healer, Chief Salome Fawarade, is the Oluwawu of the city of Ibadan. Oluwawu means the healer with knowledge. This is an honorary title of great importance conferred by the Olubadan of Ibadan, who is the traditional ruler of this city. Chief Fawarade, not surprisingly, is quite eager to maintain a place of honor and importance even in this new world, and he enjoys these visits with Dr. Olatuwuda. This is the beginning of a research effort which will continue at the research center when it opens. Suspicion and mistrust of each other's systems of treatment is slowly giving way to mutual respect. Chief Fawarade has been visited by orthodox psychiatrists from all over the world, and he has proudly framed many letters of appreciation from them, as well as letters of official recognition from the government.
Association of Native Doctors and Herbalists of Western Region of Nigeria.
The Oluwawu's patients spend their days in his backyard. To restrain the more violent patients, he uses locally found sedatives or sometimes physical restraints like these iron shackles.
This patient has been here for over a year. He hasn't put a specific diagnostic label on his own problem. He's just said he's been acting crazy. I asked him what he's been doing to help him. He indicated he's done all manner of things. He's given him herbs to drink. He's given him soap to wash. He's giving him some scarifications on the head, and also advised relatives to propitiate the gods with sacrifices and so on. No, àwọn èèyàn bá mu wá. Kí lẹ ti ṣe fún láti bí ijọ́ mẹ́rin báyìí? Ó fún lóògùn. Ṣé ó wá fúnra rẹ̀ ńgbà yẹn? Ó wá fúnra rẹ̀ pẹ̀lú balẹ̀ báyìí. Pẹ̀lú agbára nígbà tó dé ìyàwó rẹ̀ tó balẹ̀ báyìí. Ṣé oògùn tẹ fún yẹn ló jẹ́ ká rẹ̀ balẹ̀? The Oluwawu has just been explaining that this patient has been here only in the last 4 days. And his problem is that he was talking rubbish and was roaming about from town to town. Now, he is quick to emphasize that when he came, the patient was very, very disturbed in this. But when he gave him the potion to drink, he's now very, very calm and accepting of his treatment. The preparation included herbs, roots, and specific ingredients prescribed by long practice, which are easily available in the markets. And these are all put together, ground, allowed to ferment. And with this kind of very aggressive, very overactive patient, this kind of drink gets them quieting down.
The setting for Dr. Olatuwuda's own practice at the University of Ibadan Teaching Hospital is very different from that of Chief Fawarade. And this setting represents one difference that orthodox doctors would like to see changed. They feel that traditional healers should take more interest in the hygiene of their patients and providing a cleaner environment for them.
She's on antibiotics now, and the fever has gone down.
Yes. Orthodox psychiatry, with its use of a large variety of drugs and other modern therapies, may or may not be more effective than traditional psychiatry. But with patients who are tied strongly to their old ways of life, traditional doctors can do things that orthodox doctors may envy.
We know that some of these traditional healers, by talking to patients, we call this incantation or something like that, can get patients quiet. Now, this may be a psychological effect, but it would be nice if I could just talk to a patient and say, now, because the day you were born, your mother knelt down and you are born of a woman and all that. Therefore, I'm talking to you. You must listen to me and do what I say. So keep quiet and stop fighting. Now, if I could do that without recourse to injections and so on, that would be terrific.
The roots of Nigerian culture are in the countryside, where 80% of its people live. The village is the center of life, from which springs its culture, its beliefs, and its principles. Seldom hospitals or doctors located in rural areas, and yet that is where most of the people live. The University Hospital of Ibadan sends its research teams to these villages to find out how people get their health care and what they know of orthodox medicine.
Ìṣòro bá dé ní èsì oko ṣe mọ̀ pé tá a bá fẹ́ gba ẹ̀bí nísìn àbá fẹ́ gbé oògùn lọ ilé nọ́ọ̀sì gbé aboyún lọ ilé nọ́ọ̀sì ṣe mọ̀ pé bí wàá tún ṣòfò wà lọ ṣe.
Níbo ni maternity center yín wà? Ó wà ń bẹ̀ yẹn.
Tí apá àwọn ọ̀bá ká mọ́ wọ́n tún ṣẹ̀ṣẹ̀ pé bóṣòro wọn ni a máa lọ sí i a lè má rọ̀ pọ̀ ń gbà yẹn.
This clinic is 50 miles from many of the villages that it serves, yet it is very popular. Today is Well Baby Day. All the attention is focused on weighing the babies, giving immunizations, and providing general health care information about infants. Although the clinic is staffed by orthodox doctors and nurses, the songs that the mothers sing have for centuries been a way of giving thanks or praying. There are about 2,000 such clinics spread throughout the countryside, but they are able to serve only a fraction of Nigeria's 64 million villagers. The government plan is to build another 5,000 over the next 10 years. The cost of building and staffing these clinics is tiny in comparison with the cost of building hospitals. And it is here that Nigeria's university-trained doctors and nurses are beginning to gain some first-hand knowledge of the diseases which affect the bulk of the people. For example, 15% of all babies born in Nigeria do not live past the age of 5. Many of these deaths are due to malnutrition, dysentery, colds, and fevers, and the basic childhood diseases against which Westerners are immunized. This Well Baby Clinic will save hundreds of lives a year just by giving vaccinations. One important aspect of infant health care emphasized here is the keeping of records. The weight of the baby is recorded every month, along with vaccination dates and other pertinent information. In infant health care, orthodox medicine is popular with Nigerian mothers. But for other health care, most villages must rely on common sense and a knowledge of herbal law. A visit to the clinic is not possible for everyday ailments, even serious ones. This man is grinding up the mimosa leaf to put on the wounds caused by a guinea worm. This parasite infects most villages several times a year. The worm lives in water and is transported back and forth from villages to the local pond by those who gather the water daily. The larva of the worm lives in a microscopic freshwater crustacean called a cyclops. It is often picked up in the pail along with the drinking water. Once in the body, the worm grows and eventually migrates to the foot. There it emerges through the skin and deposits new larvae back into the drinking water as the people walk into the pond again to gather water in this daily ritual. The worms are bothersome, painful, and damaging on their own, but they also create other health hazards for their hosts. The wounds they leave as they erupt from the skin are large and subject to many fungal and parasitic infections that can ultimately be crippling. Local remedies keep these serious dangers somewhat in control, but basic orthodox medical knowledge of hygiene is helping to eradicate the threat altogether. This village has just built a well. The guinea worm has been banished from its interior since people no longer have to walk through their water supply. The villagers built the well together because of the interest of a public health worker from the University of Ibadan. Recently, this health worker traveled from village to village, recruiting people from each community to take a basic course in public health measures. Now, when villagers ask questions, they can get answers. The World Health Organization plans to use this project as a model for other developing countries. Nigeria is trying to build a health system which utilizes the strength of both orthodox and traditional medicine. They want to build a healthcare system and a society that is Nigerian. They want a health system that answers the needs of a country whose problems are different from those in the West.
The idea is to be much more intellectually liberal, not to throw out the baby with the bathwater, to examine what you have. The early missionaries came to Africa, India, and we were told that everything was bad, everything was primitive. Throw away all your idols. All the religions that were not Christian were absolutely, unforgivable. Your dances were sensuous, etc., etc. They took your name away and gave you Isaiah, Joseph, Stevens, and so on and so forth. The idea is the arrogance of Western culture that they could impose upon other cultures what they thought to be a superior culture. Whereas, in fact, it has now been found that what they originally thought to be an inferior culture has abounding resilience and a great deal of strength, which could maintain the human equilibrium and sustain and support, their population.
All medicines or medical practice have their merit. I have nothing adverse against the orthodox practice. It's a line of practice by itself. Just as in the same way, I would expect the orthodox practitioner to have nothing against traditional practice, because it's all medicine. We all apply the same principles.
So what you have asked me, the question do I think that in time traditional medicine will die out, is just as simple to ask me, in time, will the African culture die out? Of course not.
material on this video cassette is protected by copyright. It is for private use only, and any other use, including copying, reproducing, or performance in public, in whole or in part, is prohibited by law.